Welcome to the deep dive where we try and make complex topics clear.
Glad to be diving in.
Today we're looking at cobalamin deficiency in dogs and cats.
Vitamin B12, yeah.
Right. Think of it like maybe a spark plug for their cells. Without enough, things just don't seem to run right.
That's a pretty good way to put it, actually. Cobalamin is absolutely essential.
So what happens when they run low? Let's find out.
Well, it's involved in some really core processes, converting food to energy, for one,
Okay.
and metabolizing amino acids, protein building block.
Right, fundamental stuff.
And critically, it's needed for making DNA and RNA, the genetic blueprints.
Wow. Okay. So yeah, you can see why a shortage would cause problems pretty much everywhere.
Exactly. Almost every cell in the body relies on it.
Now, our sources for this deep dive, they focus specifically on dogs and cats.
Correct. That's our scope today.
So our mission then is to really unpack the causes, the signs to look for, and the treatment approaches for this in our pets based on the info we've gathered.
Let's do it. So the basic issue, cobalamin deficiency, it just means the body's stores of B12 have run down.
Depleted.
Yeah, depleted. And when that happens, it messes with how cells function all over.
And you mentioned absorption earlier. It sounds like how they actually get this vitamin is quite specific, not just absorbed anywhere.
Very specific. In dogs and cats, it's exclusively absorbed in the ileum. That's the last part of the small intestine.
Okay, the ileum only.
And it uses what's called a receptor-mediated mechanism. Think of it like tiny specific docking stations on the ileum cells.
Ah, like a lock and key.
Precisely. They grab onto the cobalamin so it can get into the bloodstream. If those docking stations are broken or missing, well, the cobalamin stays outside.
Right, it can't get in. So if that specific part of the gut, the ileum, isn't working right, that's where the deficiency starts.
That's often the root cause, yes.
And the consequences, the signs, they seem quite varied.
They really are. Often the first things people notice might be gastrointestinal signs.
Like what?
Things like persistent diarrhea, maybe weight loss that you can't explain, vomiting sometimes, or just a poor appetite.
And those are often signs of the underlying gut problem itself.
Yes, often there are clues that something deeper is wrong in the digestive tract, which is causing the cobalamin issue.
Got it. And then there are these bigger systemic effects mentioned, like weakened immune systems.
Immunodeficiencies, yes.
Yeah.
And even neurological problems.
Neurological. That sounds serious.
It can be. We see links to both central neuropathies affecting the brain and spinal cord and peripheral ones affecting nerves elsewhere in the body.
Okay. And are there signs more directly tied to the lack of cobalamin itself, not just the gut issue?
Yes, definitely. The sources list things like weight loss again, or what vets call failure to thrive.
Failure to thrive.
Yeah.
What exactly does that mean?
It's especially seen in younger animals. They just don't grow properly, don't develop healthy tissues, can't maintain condition. It's a real red flag.
Okay.
A poor hair coat, dull, maybe patchy. Lethargy is common, just a general lack of energy. And anorexia, which is a complete loss of appetite.
Complete loss.
And in rare, severe cases, you might see stupor or even encephalopathy signs of serious brain dysfunction.
Goodness. Quite a range from a dull coat to severe brain issues. So why does this happen? What are the main culprits causing this deficiency?
Well, the biggest category is chronic gastrointestinal diseases that specifically hit the ileum.
Where the absorption happens, makes sense.
Exactly. So conditions like inflammatory bowel disease, IBD,
Okay.
or small intestinal dysbiosis that's an imbalance in the gut bacteria.
Right.
Intestinal lymphoma, that type of cancer can do it. Even food-responsive enteropathy, where diet causes gut inflammation.
So basically anything that damages or inflames that crucial last part of the small intestine.
Precisely. If the ileum's sick, those docking stations just don't work well.
Okay. Are there other causes besides diseases in the ileum?
Yes. Exocrine pancreatic insufficiency, or EPI, is another big one.
EPI, that's where the pancreas doesn't make enough digestive enzymes.
Correct. And that whole process indirectly affects how cobalamin gets processed and absorbed, even before it reaches the ileum.
Interesting. What else?
Short bowel syndrome. If a large part of the small intestine, especially the ileum, has been surgically removed.
Then there's just less surface area for absorption.
Exactly. Fewer docking stations available.
Logical. I think the sources also mentioned some rarer inherited causes.
They did. It's uncommon, but some dogs are born with a genetic inability to absorb cobalamin properly.
Which breeds were mentioned?
Chinese sharp pies seem to have a predisposition. And there are reports of isolated family cases in giant schnauzers, beagles, border collies, Australian shepherds.
So worth knowing if you have one of those bruins, though it is rare.
It is. And finally, dietary deficiency is possible, but really only in animals on super strict vegan or vegetarian diets without B12 supplementation.
Because B12 mostly comes from animal sources.
Primarily, yes. Oh, and it's worth noting EPI, that pancreatic issue, seems more common in young adult German Shepherds.
Good to know. Okay, so if a vet suspects cobalamin deficiency, how do they figure it out? What tests are involved?
It's interesting because your standard blood tests, like a CBC, biochemistry panel, urinalysis, they might actually look completely normal,
Really? Even with a deficiency?
especially early on, or if the underlying gut disease isn't causing huge systemic changes yet.
Hmm.
But sometimes those routine tests can show clues pointing to the underlying issue, like low albumin protein levels if there's severe IBD, for instance.
Okay, so indirect clues, maybe.
Right. Or you might see subtle things like certain types of anemia, odd changes in white blood cell counts, or funny-looking red blood cells under the microscope that hint at problems.
Suggesting maybe ineffective production?
Exactly. Ineffective erythropoiesis is the term. Or maybe hypersegmented neutrophils, things a vet might pick up on.
So standard tests are a maybe. What about actually measuring the cobalamin?
That's the key, really. There are specialized tests, like measuring something called methylmalonic acid, or MMA, in serum or urine.
MMA?
Yeah, its levels tend to go up when there's a cobalamin shortage at the cellular level,
Yeah.
but these MMA tests can be, well, time-consuming, expensive, and aren't routinely done everywhere.
Okay, so what is routinely done?
The most practical step is just measuring the cobalamin concentration directly in the serum, the liquid part of the blood.
And what are you looking for there? Obviously low levels, but...
Yes, decreased levels are a clear sign.
Right.
But importantly, even levels that are in the low end of the normal range can be significant.
Ah, that low normal idea again, like the fuel gauge reading nearly full, but the car's sputtering.
Exactly like that. Some studies, the ones looking at MNA levels, suggest that pets with low normal cobalamin might still be deficient where it counts inside the cells.
That's really crucial. So normal isn't always truly normal.
It seems that way, and it highlights another point. The assays, the tests we use, were mostly developed for humans.
Right.
So they need proper validation for dogs and cats. Ideally, each lab should have its own specific reference ranges for these species to get the most accurate interpretation.
Makes total sense. So blood tests are key. What about imaging, like x-rays or ultrasound?
Imaging isn't really useful for diagnosing the cobalamin deficiency itself.
All right.
But if you suspect an underlying chronic gut problem is the cause, well, then things like endoscopy or surgical biopsies of the intestine can be invaluable.
To find the root cause, the IBD or lymphoma or whatever it is.
Precisely. To identify why the cobalamin isn't being absorbed.
Okay, so let's say you've got the diagnosis. Cobalamin is low. Maybe you found the underlying gut issue. How do you treat it?
First things first, you absolutely have to treat the underlying disease. That's critical.
Right, fix the cause of the core absorption.
If you don't, you're just fighting a losing battle with supplementation. So if it's IBD, treat the IBD. If it's EPI, manage the EPI.
Got it. And then replenish the cobalamin itself.
Yes, that's the next step. Supplementation to get those body stores back up.
What forms does that come in? Pills, shots?
Both are options. We have parenteral forms, meaning injectable.
Okay.
These usually contain cyanocobalamin, sometimes hydroxycobalamin, typically at a strength of 1,000 micrograms per milliliter.
And how are they given?
Usually as subcutaneous injections, just under the skin. Dosages vary by size. For cats, maybe around 250 micrograms per shot.
Uh-huh.
For dogs, it could be 250 for a small one, up to 1,500 micrograms for a giant breed.
Okay. And is there a standard schedule for these shots initially?
The traditional protocol involves a loading phase. Typically, it's 6 weekly injections.
6 weeks in a row?
Yeah. Then often one more injection a month after that sixth one.
Okay.
And then about a month after that last injection, you recheck the serum cobalamin level, see where things stand.
Right, see if it worked. So that's quite an intensive start. What happens after that initial course? Does the pet stay on injections forever?
It depends. After that initial phase, maintenance therapy is really tailored to the individual.
Based on those follow-up blood tests.
Exactly. If the levels are still low, they might need injections more often, maybe weekly or every 2 weeks for a bit longer.
Okay.
If the levels are nicely in the mid-normal range, maybe you can reduce the frequency to once a month or even every other month.
Right.
And sometimes, if the levels get back to high normal and crucially the underlying disease is well controlled, you might even be able to stop supplementation with Vet guidance, of course.
So it's very much adjusted based on response. Now, you mentioned oral forms too. Are pills an option?
Yes, they are. And it's something we're seeing used more often based on newer findings.
How effective are they compared to injections? I thought the whole problem was poor absorption from the gut.
That's the logical question, isn't it?
Hmm.
But studies suggest that very high doses of oral cobalamin can sometimes overcome the malabsorption, maybe through different, less efficient pathways or just by sheer volume.
Huh. Interesting.
So the typical oral approach described involves giving, say, a 1 milligram dose, that's 1,000 micrograms, a hefty dose compared to the injections once a day. Yes, daily for maybe 2 to 3 months, using either methylcobalamin or cyanocobalamin forms. And then you reevaluate the serum levels, just like with the injections.
Wow. Okay. So for some pets, daily pills might actually work and be less invasive than regular shots.
It seems possible for some, perhaps especially for maintenance therapy after levels are restored or in milder cases. Convenience is a factor too, of course.
Definitely. Okay. So once treatment is going, what does the long-term follow-up look like?
Well, it's really guided by the whole picture. The underlying disease is key. How severe is it? Is it stable?
Right.
Any complications that arose from the deficiency itself need monitoring. And of course, how well the pet is responding overall.
Makes sense.
But that recheck of the serum cobalamin, about a month after the last loading injection or after finishing the initial oral course, that's pretty standard.
To confirm the levels are up.
Exactly. And then beyond that, there's usually ongoing monitoring needed for the primary disease anyway, blood work, maybe imaging, clinical checks.
Okay. That paints a clear picture. So let's try and summarize the key points from this deep dive.
Sounds good.
Cobalamin, or B12, is clearly super important for dogs and cats, essential for basic cell functions like energy, DNA, RNA.
Absolutely vital.
A deficiency can happen for various reasons, but especially if there are problems with the ileum, that last part of the small intestine where it's absorbed.
Or with the pancreas, like an EPI.
Right. And the signs can be really broad: gut issues, weight loss, poor coat, low energy, even neurological problems in severe cases.
A very wide spectrum.
Diagnosis hinges on measuring serum cobalamin, keeping in mind that low normal might still be a problem.
Crucial point, that one.
And treatment involves, number one, tackling the underlying disease.
Always the priority.
And number two, supplementing with cobalamin, either via injections or sometimes high-dose oral forms with careful monitoring.
That sums it up nicely. And it really underscores why vets might check cobalamin levels, especially in pets with chronic gut signs or EPI or in those predisposed breeds we mentioned.
Yeah, being aware of the potential is key. Early detection can make a difference.
For sure.
Which brings us to our final thought for you, the listener. Given what we've learned, especially about those potentially problematic low normal levels, what could this mean for future routine pet health checks? Could we, or should we, be looking more closely at cobalamin status more routinely, maybe moving towards more personalized nutrition based on these kinds of tests?
It's a really interesting question. And it branches out, doesn't it? What other seemingly minor nutrient imbalances might be having significant knock-on effects that we're only just starting to appreciate?
Exactly. Definitely something to mull over. Food for thought until our next deep dive. Thanks for joining us.